गाइज, अगर आप अच्छा डॉक्टर बनना चाहते हो, यू वांट टू लर्न अ लिविंग, यू वांट टू हैव रिस्पेक्टफुल लाइफ एंड डू वेल इन लाइफ एज अ डॉक्टर, then don't think that NEET and these entrance exams is the only way. It's extremely overrated. You don't even know that it is a very small part of healthcare practice and you are putting all your eggs in one basket. कुछ नहीं करेंगे 3 साल इसका तैयारी करके पीजी करेंगे ही सक्सेसफुल बनेंगे. Only if I get a PG seat and I become a postgraduate and I do super specialty and I do a PhD after that, and after that when I have a tremors for surgery, then I'm going to be successful. Guys, trust me, somebody has to tell it to you. Nobody will tell it because it is their business is involved, but I will tell you because I have seen all spectrums of healthcare. Worked in a private medical college, government medical college, tertiary centers, center of institutional importance, PHC, CHC, rural camps, corporate hospital, nursing homes, small hospitals. I worked as an MBBS doctor. I worked as a psychiatrist. Then I did ENT. I worked as an ENT. Then worked as a teacher, innovation, everything. Invented devices, ran hospitals, ran big hospitals, ran small hospitals, everything, guys. And I can tell you that if you want to see patients, earn some money and improve healthcare, then doing post-graduation is not the only way. And I can say that today. Maybe 10 years ago, I wouldn't have said the same thing. 15 years ago also, I wouldn't have said the same thing. I myself have done post-graduation. Though I was okay. If nahi milta to I wouldn't have bothered, right? And some of my friends have not done post-graduation. They are MBBS, some of them diplomas. They're having a very good life. They're seeing patients. They're successful. Why is this so much? Why do you think that this is the only way? Okay, now let me give you some statistics. There are about 650, maybe 700 medical colleges in India. That's all, right? There are about 50,000 hospitals. And hospital growth is going to be exponential over the next 10, 15 years. Your course of an MBBS or as a doctor is not designed to be employee based. Initially, institutional medicine was practiced because infrastructure was very, very expensive and very, very hard to acquire. So many doctors could not practice because they were dependent on infrastructure, on institutions. The CT scan nahi hai, MRI nahi hai, ultrasound nahi hai. How will they treat? How will they do surgeries if there is no linear flow in their operation theater? For all of those reasons, institutional practice was established. It's good 10, 15, 20, 30 years ago, okay? And salaried jobs for doctors was given with a mindset that let us detach incentive to the practice so that the practice is wholehearted. उसका opposite होता है, अब हम नहीं भी करेंगे, ढंग से भी नहीं करेंगे तो भी पैसा मिलता है. But that is a very modified and a small part of practice. Medical field is an independent field. It's a freelance field. A person who is a doctor can put up shop anywhere without too much investment and look after patients, treat patients and provide care, earn a basic livelihood and make a difference. But we do not think that way, and thousands and lakhs of people want to do just one thing, which honestly, guys, think about it. Nowadays, nobody really asks all of this, which super specialty and all of that. And I'm not trying to just simply tell this to you. I'm telling you this because I have seen the wider chunk of healthcare has nothing to do with the super specialization. The wider chunk of healthcare is creating healthcare opportunities, creating clinics, creating hospitals, creating nursing homes, creating ICUs, ventilators, all of those kind of things while doing your practice. And it is far more rewarding. I'm telling you, you will not see any private practicing doctor or doctor who's independently doing practices dying to go to US and UK to earn money thinking udhar zyada milta hai. नहीं. उधर बिल्कुल ज्यादा नहीं मिलता है, आपके सैलरीड जॉब से ज्यादा मिलता है. एंड गाइस, सैलरीड जॉब इज सैचुरेटेड एवरीवेयर. व्हाट आर यू सेइंग दैट यार इफ आई डू ईएनटी देन आई डोंट वांट गेट अ जॉब. इफ यू आर वेटिंग फॉर अ जॉब, नो, कि हाँ मेरे को पैसा दो ताकि मैं काम करूं, obviously that is going to be saturated in any walk of life, okay? That is saturated for any salaried job. It's not only this. There are only 700 medical colleges. There's going to be limited posts. That is all that is there for lakhs and lakhs of people doing medicine, right? There are 50,000 hospitals and small positions are being created. Majority of these are in semi-urban, rural areas. उधर जाने का नहीं है, मेरे को सिटी में ही रहने का है, मेरे को पार्टी भी करने का है, मॉल में जाने का है, मैं इधर से नहीं जाऊंगा. एंड बोलते हो कि यार बहुत सैचुरेटेड फील्ड यार. 1.4 billion people and there are about a few thousand doctors. Like say for ENT 16,000 doctors, pediatrician 29,000 doctors, neurosurgeon few thousand doctors. MBBS about 8 lakh doctors for the entire 1.4 billion people, and you are saying saturated. किधर है दिमाग तुम लोगों का? It is saturated because it is in the place where you want it to be. You are not willing to move yourself somewhere else. You are not willing to you go slightly outskirt, go semi-urban, rural. Modernization is happening everywhere. Decentralization is happening everywhere. You go to a town, it's all smart cities, electronics. Your technology is there. Your hospitals are so well equipped that you can have a good practice, earn good money, and make a difference. And guys, let me tell you one thing. Okay, before all of this, मैं नहीं होता, हमसे नहीं होता. I'll tell you one thing. A good doctor is a doctor who someone can trust. You do honest practice and you do not take advantage of a patient's illness. You do this, you cannot do bad as a doctor. Honestly, I'm telling you that. All right. I have patients from my MBBS days who still remember and follow up with me. All I did was just spend some time with them and explain them what they were doing. That's all. There are some patients who follow up with me, know me. I did 6 months of psychiatry before doing ENT. Some of my patients still come and call me and said, "Oh, doctor, the medicine is this is this." They don't care I'm ENT anymore. They're not saying, "Oh, iska ENT ka degree, why we are asking him psychiatry." I have given treatment to a lot of patients with OCD because I did a non-PG JR in NIMHANS. And they know I'm an ENT, but they still follow up for the psychiatry with me. Why? Is it because of the degree? No, because they feel that whatever they could connect with me, and I was giving the right explanation, and they were able to feel that they're getting better with it, and the medicines were working. And at the end of the day, guys, that is what you need to focus on. If you are able to treat somebody, there's no best doctor or anything like that. All you need to be as a good doctor is establish honest trust. Spend time with the patient, explain to him or her what is going on. If you don't know, say, "I don't know, I will find out," or go to somebody who is better. Do not give false hopes. Treat them in the right way. Charge them appropriately. And if something is bad, say it's bad. Something is good, say it's good. Just that is all that is needed. It's human behavior. And you will be a good doctor. People will come to you and they will follow up, and you will be able to grow as a doctor. So guys, if you don't crack the NEET PG, you don't get into any entrance exam, it's fine. Okay, it's fine. Trust me. Now it's very different. Now practice is decentralized. You can, with 5,000 rupees or 10,000 rupees, you can buy or rent, sorry, not buy, you can rent a clinic space. Everything is on your phone nowadays. Technology is on the phone. I have an endoscopy camera I carry. I do endoscopy. I got patients from all over the world who are just sending me photos and videos of their ear, nose and throat. I don't even have to go in person. Right? You can do ultrasound portably. There's so many labs that are open now. You can get a CT scan, ultrasound, MRI anywhere in your vicinity. Pharmacies are open everywhere. You don't require, imagine even if you charge 100 rupees per patient, you get 10 patients per day. That's 30,000 a month of revenue for 5 to 7,000 rupees of rental expenses and maybe 3-4,000 of some other things. That's about it for you to start, right? And that 10 patients at 100 is a very, very reasonable thing. Okay, maybe first 1-2 months nahi aayenge the patient, but as you stay there, as word of mouth builds, you can start having maybe 20-30 patients a day. If you have 30 patients a day for 100 rupees for 30 days in a month, that's like 90,000 rupees. Agar wo 200-300 kar do, you can do the math, guys. It's not a lot of money. It's not cheating. It is not exploiting. It is just basic money for your time and your expertise. And it is reasonable, and you're able to treat people and improve their lives. That's as simple as that. You're not willing to do that. You all want to do something that you feel is going to be secure and safe, and you're all fighting and just waiting for months and months and years together to get in. Maybe you're not even cut out for it. I've seen so many PGs, so many doctors just quit saying that, "Yeah, I thought this was something else, but this is really not up for me. I took it because somebody bola radiology mein crore milte hain." But they're not able to sit for 3 months and just look at films. They're not able to do that. Some people are saying, I wanted to take up orthopedics, but they have a slip disc in a year. They're saying this is too much traction. I'm not able to do it. It's you spend time in the hospital, shadow your favorite doctors, work in the field that you want to feel. You can do fellowships, you can do certificate courses, you can establish yourself as an expert in a domain, you can do basic surgeries, you can treat patients, you can set up centers, set up hospitals, set up clinics. How much you spend for your post-graduation or lakhs that you spend in private medical colleges, you can set up a small nursing home, and you can hire and grow a healthcare facility, give jobs to other people, and create bigger impact to patients while you practice in your own facility. अपने आप को तो लोगे ना. So think about it that way, and don't take NEET or these exams as the end of the road कि हाँ यही करना है, अगर नहीं मिला that's the end of the world. You are absolutely wrong, guys. It is just one of the things. Take these fields only if you are really interested in the field and you want to do more in it. But if you just want to see patients and have a livelihood, there are a lot of other ways to do it. think about it that way. Don't take stress. Don't lose a day without clinical practice. Don't lose a day without being in the hospital, seeing patients, learning from others, and shadowing doctors. That is the way that's going to make you a good doctor and stay updated. All right, guys. Honest advice, take it however you like, but somebody has to tell it to you, and it can only be someone like me who's always starting troubles. Take care. Bye bye.